welcome to Senior Solutions. I'm your host, Karen Halloran from Azure Healthcare. Today on the show, we have Priscilla Costa and Leah Mullen from Community Nurse Home Care. Thank you for coming on the show, ladies.
Thank you so much for having us.
Yes, thank you for having us.
We may as well just dive right in. You can tell us where you work and all about Community Nurse Home Care.
So we work for Community Nurse Home Care. It's a visiting nurse agency out of Fairhaven, Massachusetts. We service patients in their home. So that includes nurses, physical therapists, occupational therapists, also speech therapy, and we also have palliative care, hospice care, and a memory loss program as well for patients in their home.
You have a lot of services.
We do.
That's awesome. Everything people need.
Yeah, and a fun fact actually is we were established in 1916 in Fairhaven. Yep, 1916, and the nurses would go to homes on bicycles.
Wow, isn't that amazing?
We don't need bicycles anymore because we
No.
cover a greater service area now. So,
But it sounds like you have to put your roller skates on. You guys are busy.
Yeah.
What kind of people does your organization help?
so we tend to help people that have trouble with managing any of their chronic illnesses. So we work with people that maybe have memory issues, people that need after care for surgeries or hospitalizations, stroke concerns, heart failure concerns, and Priscilla, if there's anything I'm missing, we do help people that are at end of life and have terminal illness as well with our hospice program.
That's fantastic. How do people get connected with services?
So the best way to get connected with us is, first of all, speaking with their doctor. So or they can call Community Nurse, 508-992-6278. And they can ask to speak with anybody, an intake particularly, or myself. But the best way would be speaking to their physician, because we can't see a patient in their home without a doctor's orders. So
That's good
but
to know.
that would be an important piece.
What does a typical visit look like?
So the first visit is usually done by a nurse, and the nurse will do basically an assessment of vital signs, blood pressure, heart rate, listen to their lungs. We do go over their medications with the patient. We also, any medical history that's pertinent to the patient, which is all their medical history, we just go over all of their conditions that they need help managing, whether it's diabetes or heart failure, etc. But that's basically what the visit would look like. We also do talk about our other disciplines like physical therapy and occupational therapy and home health aides if the patient would need that, and they go over a plan with each patient.
That's great. I know you touched a little bit upon hospice, but do you want to tell us a little bit more about the services that you offer?
Yeah, so our hospice program is really helpful to work on supporting people and their loved ones when you're at end of life or have a terminal illness. So we have a really close-knit people that assist care plan as far as nursing, home health aides that assist with bathing and dressing. We have social workers like myself, so I would offer emotional support and then also assistance with community resources, anything else you might need in the community. We have chaplains that offer assistance with spiritual support, maybe connect you to your ministry, your place of worship, and volunteers that are quite lovely.
That's fantastic. So if anybody's looking to volunteer, they could get in touch with you as well. I know you had said your phone number at the end. We will flash the information so that you can get in touch with them if you would like to. Another question, who would be appropriate to have hospice services?
So hospice services is anyone that's facing a terminal illness such as cancer, not receiving any more treatment, or some patients with Alzheimer's, and we do have patients on hospice with heart failure. So it's a number of different conditions, but hospice, it's not necessary that a patient has to be bed bound and not getting out of the house. The focus is really to have someone at home as safely and as comfortably as possible, and we're focusing on quality of life. So it really is, there's a number of different conditions, but anyone that's facing the decision of possibly end of life. And their doctors would have to do a lot of that conversation with them as well.
Such great services for end of life. It's such a very tough time for people. You also mentioned about your volunteers. Do you want to tell us what they would do?
Yeah, our volunteers are such wonderful people. A lot of them actually are retired social workers and retired nurses. Now they are hands-off, so they can't provide any assistance with personal care, but they can offer companionship in the way of maybe reading with you, playing cards. Sometimes they can help your caregivers with running errands, you know, groceries, or maybe to spend some time with you while your loved one goes out to an appointment.
Isn't that wonderful? Because we know about caregiver burnout and everything, and people want to be obviously around their loved one when they're passing, but it's good to have a break. That's wonderful that you do that.
Yeah.
What do you offer for families after the individual passes?
So we do offer a very good bereavement program where we offer support to your loved ones up to 13 months after your loved one passes away. And that's in the way of support groups, one-on-one phone calls, supportive mailings. We've had a lot of patients that have called us back to talk about how wonderful it's been to get that support, and the poems that we send out really kind of resonate with them. So it's important for you to know that if you're facing terminal illness and end of life, a lot of times you worry about your loved ones, and we very much support your loved ones throughout this journey and afterwards.
Fantastic. Hospice is very difficult to work in a field. Why do you do it?
I do it because, you know, it's really rewarding being able to help families and patients throughout one of the most difficult parts of their life. And it's an important part of their life, and that's families, that's where people are at their most vulnerable. And it's really rewarding to be able to help them through this and be a support to them. So that's why I do it.
That's awesome.
Yeah, I agree with Priscilla. We get asked this question quite a bit. And sure, it's difficult. It's some of the hardest work I've ever done. But we celebrate newborns, babies coming into the world. I really want to make sure that we're honoring a life well lived and allowing you to reminisce and have that supportive conversations with your loved ones. So it always feels like an honor and privilege to be with somebody at end of life.
Absolutely.
You're special people. You really are.
Thank
we
you.
need more of you in the world.
Thank you.
I was just going to finish up the show. I asked 3 questions. Okay, you ready?
Okay.
Tell us a fun fact about you.
You go first.
Okay. Well, I'm a huge Taylor Swift fan, a Swiftie, if you will.
Awesome.
I'm a big Disney fan. I love Disney. I want to go every year if I could.
That's great. And then the second question is, we love pets on this show. Do you have any pets?
I do. I'm a huge pet lover. I have a 12-year-old dog, Shih Tzu. Her name's Bella.
Oh.
And then I have a 5-year-old chocolate Labrador named Indy, and a 12-year-old black kitty named Teddy Bear.
Oh, you have a lot.
I do.
Priscilla?
I do have one dog. He's a 9-year-old lab boxer mix, and his name is Bergie, after
Nice.
Bergeron from the Bruins.
That's
Oh.
So
That's awesome. And a final question. Summer is approaching. Do you have any travel plans this summer? Any vacation plans made?
I do. So I'm actually going with my husband and his family to the NASCAR race up in Loudon, New Hampshire.
Nice.
that's nice. I don't have anything booked, but we did just come back from Disney.
Oh, Disney again.
Yep.
That's awesome. Well, I'd really like to thank you for coming on the show today. You are a wealth of knowledge. You really are, and you're special people. At the end, we will flash their information if you'd like to get in touch with anybody. And I'd like to say thank you for joining us today. Until next time.